Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Streptococcus pyogenes or Group A strep. So, Group A strep may cause institutional outbreaks. In terms of its pathophysiology, they are beta hemolytic bacteria, and they are also long-term pharyngeal carriers. They are encapsulated and are made from hyaluronic acid. The associated diseases include pharyngitis, which is commonly known as a strep throat, impetigo, cellulitis, and erysipelas. I'm sure all of you are familiar with cellulitis at this stage of your training. Some of you may not be familiar with erysipelas, and for those of you who are not familiar, erysipelas is basically a superficial cellulitis with very well demarcated borders. It's also associated with scarlet fever, which has a classic triad of strawberry tongue, pharyngitis, and a diffuse rash that spurs the face, as well as necrotizing fasciitis, which is a true surgical or orthopedic emergency. Its associated diseases also include septic arthritis, rheumatic fever, which, just delving into a bit of pathophysiology for you, in the case of rheumatic fever, this is caused by M protein interfering with the process of opsonization, affecting the myosin, especially in the mitral valve, through molecular mimicry. And finally, it's also associated with one of MRCP favorites, which is post-streptococcal glomerulonephritis, or PSGN for short, which is a type 3 hypersensitivity reaction, and it normally occurs about 2 weeks after the initial strep infection. As far as its management is concerned, you can certainly consider checking something called anti-streptolysin O titers, or ASOT titer for short, to help you with diagnosis of a recent strep infection. However, the management of this is going to be based on penicillin. If you have an allergy to penicillin, then you could consider using erythromycin. However, it's really important that necrotizing fasciitis is picked up urgently and referred to the surgical/orthopedic team for debridement, as it is a true surgical emergency. Let's do a question. A 10-year-old boy presents with a sore throat, fever, and tender anterior cervical lymphadenopathy. On examination, his tonsils are erythematous and covered with exudate. A rapid antigen detection test for a Streptococcus pyogenes is positive. Which of the following complications is most directly associated with the untreated infection by this organism? A. Hemolytic uremic syndrome, or HUS. B. Acute rheumatic fever. C. Pertussis. D. Diphtheria. E. Acute glomerulonephritis. So if you want to pause your video and have a think about what we've discussed today. So the correct option is going to be acute rheumatic fever. As you recall, Streptococcus pyogenes is not really associated with pertussis, diphtheria, or indeed hemolytic uremic syndrome. It is associated with glomerulonephritis, however, this is not the acute type, and this is the chronic type, which manifests as a post-Streptococcus glomerulonephritis approximately 2 weeks after the initial infection. Therefore, even if you're not familiar with this bacteria causing acute rheumatic fever, by the process of elimination, you should be able to get to the correct option, which is going to be option B. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.